Hey, good morning, officially, everyone. This is the kickoff to Tune In Tuesdays. We have never done this before. I'm Instead Ellis, and also the co-host is Courtney Hudson, my assistant for marketing, and she is amazing. She has come up with all of these topics, folks. We brainstormed it, and because she has a degree and just got her degree in social work, she was like, these are the topics we need to talk about. We just need to talk about this and make sure that we're tuned in so we can be the best version of ourselves, the most healthy version of ourselves. So on the call, we have one of my most awesome clients. Joyce is on the call. And then also Jennifer Schaefer is on the call from the Alzheimer's Association. She's the walk director for St. Louis. And hopefully we will find out that they've moved up in position for this past year from number 8 out of 600 walks nationwide to number 7. Cross our fingers. We think that's going to happen. And then also from the car, we have Denise Huber with Martha's Hands. She is a fellow author also, and a mother extraordinaire and a grandmother too, folks. As she takes care of so many families, she and her husband in St. Louis. Oh my goodness, I think it's over 200 different families, and all of their caregivers with Martha's Hands are trained in the ways of Mother Teresa. Oh my goodness, we have wonderful women on this call. So it's being recorded, but right now we're live, so anything can happen. I'm coming to you from Essence Healthcare. Lumeris is the location out in Riverport, St. Louis. I'm here this morning giving feedback about the annual AEP, the annual enrollment period this year, and I'm one of 20 that was invited. I said, I got to step out because we got to kick off Tune In Tuesday. Without further ado, let's get it going. So, Courtney, if you could start showing some slides. This should be pretty quick as we go through this.
Yep. Give me one second. I've never done it before, so just bear with me.
Yes, absolutely. So as she comes on, you'll see Tune In Tuesday is presented to you and brought to you by my actual website, which is dianeinsuranceSTL.com. So you'll be able to find these. Courtney's son is the one that takes these videos and then he turns them into YouTube videos and then he loads them onto the website. So thank you to Courtney's son. She's raised a brilliant one, thank goodness. So we're all better because of it. So we're going to present women's health today because it is important that we talk about women's health because it's up to us to make sure that we are our best advocates. So, and we're also going to talk about the disconnection in healthcare to women everywhere. So, Courtney, I'm already on slide 1.
Okay, it's wanting me to enter in your password to share my screen. So I will either have to jump on a different computer or not share the screen.
Okay, well, we'll just keep going. So,
Okay.
and then what we'll do is we can put the PowerPoint on with, right next to the actual recording of this, if that's okay with you guys. If that's okay with you guys, give me a thumbs up. That's cool. Okay, so we're just going to keep on going. So here's some disturbing statistics regarding women. Get ready for this, folks. Okay, one woman. So you're looking at, here's the number 1. Women have a longer life expectancy than men. Big surprise. But spend a greater portion of their lives in ill health.
No.
Let that soak in. In 2050, the number of women aged 60 and over will increase to 1 billion from 336 million in 2050. For every 100 men aged 60 and over, there are 123 women. Women are 4 times as likely to have their pain or symptoms dismissed or undertreated currently. Women will wait twice as long for a diagnosis or a treatment. So if you are receiving that information for the first time, it is overwhelming. Anyone have a thought on this? Like, I didn't know that. Or were you all aware? If you were aware, give me a
No,
thumbs up.
no, didn't know that at all.
Didn't know that at all.
Yeah.
So
But
the
I
first
think
question is,
sometimes women,
huh?
I think sometimes we as women get busy with not only our professions, but our families, and we sometimes put ourselves on the back burner.
Absolutely, we do. And we just keep it going, don't we?
And it's hard to not do that.
Oh, absolutely. And so the first question that everybody has is, well, why do these disturbing statistics exist? And so there's underrepresentation in medical research, number one. Number two, women's symptoms are mislabeled or they're invisible. And then there's overwhelming and expected societal roles, which is what you're talking about, Joyce.
Exactly. Yes.
And so let's start there. So women carry the majority of unpaid caregiving through their lives. No better do we know this on this call, especially with all of us having firsthand experience with caregiving, not only for our own family, but for other families. And
Yes.
so it's one where we look at taking care of children. We look at even adult ones, no matter what age they are. There really isn't an age out for a child.
No.
We have adult children, for aging parents, for declining spouses. And this leads to delayed appointments, ignoring symptoms, and economic inequalities. And health outcomes follow income. So our income decreases because of the health outcome that we have for our loved ones. So we will sometimes just say, I'll put it on the back burner. I won't go get this checked out. I will take care of you first. And we've all heard the old adage, who do we give the oxygen to first? It's supposed
Yeah.
to be ourselves
No.
before we give it to somebody else. But oh my goodness, it's hard for us as women to do that, isn't it? So, the underrepresentation in medical research, clinical trials exclude women. Only up to about 40% of the trials are for women. And this leads to mostly a male body, quote unquote, default for symptoms and treatment that doctors follow and prescribed. So, side effects in women will go unreported and then they're missed. So oftentimes the medical research is looking for funding. Who has the money? Well, majority, the money is men. So it is driven by money, and they're also looking for proof and they're looking for non complications. Our bodies, women, are complicated. We are complicated. Men are a little bit more understanding as far as, or understood as far as their bodies go. But because we go through so many changes and because we are the creators in this world, our bodies can create lots of changes and we are so surprised by them.
Yeah.
So women's symptoms are mislabeled or invisible. Often doctors will dismiss symptoms to be emotional or psychosomatic. So let's talk about that for just a second. Women process from emotion to logic. Men process logic, and then they might process emotion when they open up to a woman. But sometimes they don't process the emotion at all.
That's
If
not
you know what I
often.
mean. And you got to drag it out of them. So, and see what's going on. But I will say that because of this, we have to have advocacy. We either have to be our own advocate or we have to find someone, a buddy, that's going to be a good advocate. So here's some more statistics in women. So heart disease is the leading cause of death in women, 1 in 4, and heart attacks are 50% more likely to be misdiagnosed in women. Why? Because we have complicated bodies. We usually have a multitude of things going on with us. So it's very difficult not only to diagnose something, but it's very difficult to get a code when you're in the hospital for what is actually happening. So we would probably be able to get 3 or 4 codes going on because it's affecting us all over the place. But unfortunately, the way that our insurance works these days, we got to get one code, and they got to decide on it. Otherwise, we're not going to have all the options that we need or we can actually access. So doctors take an average of 2.5 times longer to diagnose women. Let's think about that for a second. They take 2.5 times longer to diagnose women with cancer than in men when experiencing similar symptoms. Why? Because we're complicated and doctors don't want to be wrong. They want to see patterns. They are taught to see patterns because if they have a treatment that is not the same treatment for another person that has the same pattern, then they're out of pattern with all of the insurance companies. They're red flagged then, they're asked questions, and the doctors can be audited. Nobody wants that. So who triggers an audit more than a man? A woman does. Consequently. So we got to advocate for ourselves. So there's around 80% of all autoimmune diseases are experienced by women, yet women wait years for a diagnosis. I will tell you that in recent research, it does show that the autoimmune occurs because of our lack of not acknowledging something that's wrong when it's wrong. That we wait so long that it has adverse effects throughout our body. So we can feel things emotionally and it can center throughout our body and create dis-ease. Much more so than a man because we carry it longer, because we have other people to take care of. So we need to take care of who? Ourselves. So how do we address this? We need to prepare. We need to be ready when we go to appointments. We need to have confidence when we're speaking about ourselves. We don't need to ask questions. Ladies, one of the things that we do is we will state a sentence and we'll end it with an uptick. So, for example, I might go to the doctor and I might say, I feel like I'm having a little bit of a sore throat. Or you can say, I feel like I'm having a little bit of a sore throat. Which one sounds like the one you want to address? The second one. So tails down in your speech, ladies. Don't ask a question. Be confident. So prevention, future harm. Think of the things that you want to embody and think of your future self with wellness, not with illness. So it's a lot easier and a lot less expensive to take care of your wellness than to take care of your illness. So prepare, write down some things, have a note by your phone or put your notes into your cell phone and keep track of all of your concerns. So you could keep a list on your phone right now. You'd say, okay, in notes, I need to make this. I'm not feeling good at 7:00 in the morning because I'm eating such and such the night before. Mm-hmm. Just take note of yourself. Be a student of yourself.
That is so awesome that you say that. My doctor, I go in for my appointments, we go over whatever I'm there for, and then he will say to me, okay, what's on your list this time? Because he knows that I have a list on my phone that I'm going to ask questions that I've thought of from last appointment to this appointment that I need answers to.
It is so important.
So, yeah.
It is. Joyce, you're so awesome. Because nothing's too small to bring up about your health. And you got to pay attention to the patterns because they're harder for your physician to ignore at that point because it's in your record.
Yeah.
And we'll talk about that in a second, making sure it's in your record. And bring someone along for support if you feel you need to. I always do because, again, we process, and I'm not immune to this. I process things emotionally before I process them logically. That's the way we are built, ladies. It's actually science. So let's hear about this for a second. A man's ear is formed differently than a woman's ear. And if we think that an ear is formed differently, you can think that just about everything is formed differently. They look similar, but they have different reasons. So, as a former music teacher, one of the things that I learned was that a boy's ear can hear low sounds much better than they can hear high pitched sounds. So you think of the times of war when they would start something, it would be the drums. Anytime, Civil War to any kind of war in the past, they always had drums, and that would be the call to war because a man can hear it. They're supposed to be able to hear that sound. They also can hear the roar, which the drum is actually emulating of a tiger, the saber-toothed tiger. It goes back that far, ladies. So then you think of a woman. What is she supposed to hear? She's supposed to hear the cry of a baby. And so we hear high-pitched noises. So if we talk up here like this, and we talk to our doctor, and we say, oh, this is what's going on. Are they going to listen to us if it's a male doctor? Maybe even a female doctor is going to say, I'm not listening to that because it's not their pitch. So the pitch of your voice is your pitch for yourself and your advocacy. So just think with me, as a music teacher, I learned that more boys will play the bass and play the drums because they can hear it. More girls will play the violin and the flute because they can hear it. And when you watch a symphony, you can see it. It's amazing. So we are created to be able to hear these things. So just know that these things, these subtle differences, you are made as a woman to be able to express yourself. So expressing yourself emotionally, that might not be received. So you have to just take a minute, have a buddy, and express yourself in a way that makes logical sense. If you need to take a moment, put your hand on your chest, put your hand on your navel. That'll always give you a lot of confidence. Take a deep breath and then state what you want to state, but not as a question. Don't make them question you. Make sure you're very straightforward in your presentation. So, which brings me to presentation. And that is, use your language that's clear and assertive. Make sure you say, this pain is affecting my ability to. It's a very powerful statement. This pain is affecting my ability to, you could say, go to the bathroom. This pain is affecting my ability to work out, 3 days a week like I used to. This pain is affecting my ability to do the dishes because I can no longer bend over. This pain is affecting my ability to sleep. I cannot, and be very clear, I cannot sleep between 3 and 4 in the morning. And I fall asleep every night at 8 o'clock. Do I need to go to sleep earlier or later? Get very specific. So don't minimize your symptoms because you think maybe it might not be received from your doctor or from whomever you are speaking to. It's your truth. So speak your truth with confidence and always seek out clarity, because you can say things like this. What diagnosis are you ruling out? Now that you've heard this, what are you ruling out? And then pause and wait for them to think and receive that question and answer the question. Do not fill that space with your voice. And that's what I have a problem with myself. I'll ask a question and I'm like, oh, I'll just fill it in. I'll just close the loop myself because they're not answering fast enough. Well, no. It's a conversation, and just get uncomfortable with being uncomfortable. Be comfortable with being uncomfortable. And then ask them, what tests support your conclusion? So you're going to ask, what diagnosis are you ruling out and what tests support your conclusion? And then say, is it going in my record? Put that in my record. what you just said. And then you're advocating for yourself because let's face it, ladies, nobody else is going to advocate for you. So you have to be your best advocate. So if you do not agree with what the doctor is saying, use your voice. Just because a doctor is nodding and saying, oh, so that pain is not really that bad as it was before, and they're nodding their head yes, it makes you feel like you're going to agree with them, doesn't it? Or you might look stupid. But if the doctor is saying to you, oh, that pain sounds severe. Yes, it is. It is a severity level of a 7 out of 10 throughout the day. And at night, it's a 9. Give them a level. Let them have a reference because it is your straight talk that's going to help you the most. It's you advocating for you. So if you want to see a specialist, request it. Get it in the record. Get it in the record that you want to see a specialist. And women are taught to endure, aren't we?
Yep.
And then advocacy is not confronting. You're not confronting. You are asking for your own God-given protection. You can protect yourself. It is up to you to do it. So question everything. Sign this piece of form, sign this form, sign that form. No, 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 no. You read that form, you get a copy of that form, you know what you're signing, you understand what you're signing, and if you don't understand it, you ask and you put it in the record that you asked to understand it. Because Lord knows we don't want to have any extra costs come your way because you didn't advocate for yourself. So get very clear. So if you're dismissed, make a small and powerful request. This is what you say. Please document that I've requested further evaluation and that it was declined. So if you ask for something, you need to say, please document that I've requested further evaluation and that it was declined. And this statement is a game changer often because now they know you are serious about your health.
In your chair.
So recognize that you're not being difficult for wanting proper care. You are not being difficult. You are being your best wellness advocate that you possibly can be. So trust your instincts. If your provider dismisses you once, they may again. So if that continues, then you know that you need quality and you can seek it out. That doctor is not the only doctor in the world, and do not let that doctor ever minimize you as a person or as a patient. It is for you to establish, this is the boundary. I am wanting to be informed about my body and about my choices and about my options. So prevention is not passive, it's proactive. So review medical coverage yearly. You can do this. And you can look at your records. You can ask for your records. Fill in any gaps you can with any kind of extra coverage that you may need in order to get the health care that you need. And there's many, many ways to do that. But today is not about advertising for insurance. Today is about making sure you know how to be your best wellness advocate. And sometimes having the best insurance for you is a way for you to call me and say, Diane, what are my choices? And I'm happy to give them. So anyway, commercial break. So we have scheduled preventative testing when you need to. So according to the doctor, this is critical at making early diagnosis. It's also very important from an insurance standpoint that you follow what the doctor has suggested for you, because then it shows the insurance company that you are compliant That way, if the insurance company approves something for you to have done, they're not going to have questions later thinking, is she going to do it or is she not going to do it? Because it's been approved for you to have done. So it's got to be something that makes sense in your medical portfolio for them to say, yes, I agree, you need this preventative diagnosis. You need to go search and have more diagnostic testing, and all of that is, if that's all in there, you better follow up and you better do it. Because if you don't do it, they might just not approve it the next time. So always, always, always be compliant and play the game. So even if you're like, oh, I don't want to do that physical therapy, doctor. I don't. Oh yeah, you do. It's been recommended. Yes, you do. And you don't want to turn it down, because guess what? Next time you might not be offered it if you turned it down. So always investigate and ask questions and say, what will happen if I do not accept this as a protocol? And you want to know what the ramifications are. So schedule and utilize annual wellness visits. Oh my gosh. Okay. I give you this. I was one of those. I thought, I don't need to go do that annual wellness. I feel good. I know I'm fine. Okay, don't be like me. Don't do it. What you need to do is establish a baseline on everything. Get your mammogram, get your colonoscopy, go and have your skin checked, go and have your labs, go and have all that. You need to have a baseline, because if you become ill, they don't have anything to compare it to when you were healthy. So diagnosis takes much, much longer. Duh. I mean, how do I not know that? I have 3 degrees, for gosh sakes, people. I should know this stuff. But I'm telling you, it's emotion rather than logic. So I'm going to say it, think like a man and get all that stuff done. And all check your list, and then you're done with it. But you've got to have those baselines. Okay, so now that we know about gauging the illness, I would like to know, we've got the presentation, we've got the prevention, we've got the preparedness. Your lived experiences is your expertise. So today, I would love for Denise Huber to let us know, if she'll let us know a couple of things from a perspective of being a caregiver, serving caregivers, serving families. What do they need to know as far as from your expertise and being prepared for their health and health change?
Best way to be a caregiver is to learn from a caregiver. Best way. So everything that you do as a caregiver, you've been taught by either your family, your mother, your father, your family, your first family first, and then the physicians and the experts that your family put you in front of. And you're all doing wellness care, so you've learned early. And then you stay, well, this is how you become joyfully well and live long and well, is you stay humble. So when you are experiencing health issues, like you say, that puts you into a position of not having a life that you want when you're not well. So you ask questions and you stay humble and you desire to do with the person that knows more than you desire to do that.
Awesome. So Jennifer Schaefer, please add to that as far as the experience. I'm looking at the 10 things, the 10 signs. I don't know if you guys can see this. Yep. Maybe.
The 10 warning signs. Well, foremost, Denise and Diane. Denise, thank you so much. And Diane, what a tremendous opportunity here to talk about women's health. And I appreciate the advocacy being teed up and ready when you meet with your physician to have that list. But I, want to share that everything that you have given here in this presentation is exactly what we're facing in the Alzheimer's and dementia realm. We're looking at $1 trillion by 2050 being spent on this dreaded disease. And also what we're looking at is the early detection. So those doctor's appointments, Diane, that you're talking about, and being an advocate for yourself is so paramount. Women are 50%, two-thirds more, excuse me, more likely to develop Alzheimer's disease or a form of dementia than men are. And the Black and Brown communities are 50% more likely to develop Alzheimer's or dementia than the Caucasian communities. And we don't know why, but you touched on this beautifully, is women take care. We are the caregivers. We are the caregivers in our families. We're the caregivers of our offices often. And what happens is we put ourselves last. And, we cannot put ourselves last anymore. And those 10 warning signs, many individuals choose to ignore with regard to identifying dementia, from losing your keys to not remembering a loved one's name. And, if you're not going to say something, then the doctor is not going to know that there may be an issue. So it is so important to know 10 warning signs. And I just want to share, June is Brain Awareness Month, and we will be giving a large presentation, a little bit more of the 10 warning signs, the 10 healthy habits, the importance of risk reduction. What we do now can affect our brains later, and also the importance of early detection.
Absolutely. And with that prevention piece, Denise is going to share. There is an upcoming, it is wonderful. And I hope that Jennifer and I know I will be there. And Essence, Randolph from Essence Healthcare might join us too. We just got a booth at Denise's event that she has coming up on February 21st. Denise, tell us about that.
Very exciting. It is a healthy resolutions and wellness event. And Martha's Hands has been pivotal in the last 30 years in caregiving and longevity and keeping people joyfully well in their homes. And now we get to be a part of the prevention, about acknowledging things that aren't going well and then figuring out ways that can help you stay alive and well. And this event will offer different testing and screenings, and all for free. And it supports your local community. The experts that are your next door neighbors are going to be there. And what better way than to support your community than to support yourself by going and learning all the ways that you can stay joyfully well.
That is awesome. I cannot wait for that. That is going to be such a good time. I know that one of the things that you had shared was that the fall risk for everyone, especially women, is such a big deal. Oh my gosh. And how do we prevent those falls? And
so
how
one
do
of my wellness.
Go ahead.
One of the things that, after doing care and helping people stay in their homes as long as we have, and we've helped over 8,000 families in St. Louis area since 1997. So one of the things that we have learned, along with dementia and cancer and all of the other diseases that come about that we acquire as we get older, is to prevent those things. And that's where Martha's Hands has been able to step into that arena. And we will be doing a balance test there, where the brand new technology hasn't ever been out before is going to be introduced at that event. And I highly recommend coming to our Martha's Hands Wellness Solution table, and you'll get your own balance test to see your balance and see how well you are, and then help prevent you from fall. The statistics are nuts. 1 in 4 older adults actually That's over 15 million US seniors reporting at least one fall annually. About 37% of those who fall report injuries serious enough to need medical treatment or limit activity for at least a day. And the amount of productivity and life that you lose because you fall are significant, and we want to be a part of keeping you up and well. Come to the
Oh my
event.
gosh, it's
It
so
is
important.
the
It is
Lodge
so
to Pair,
important. Yeah, go
February
tell us
21st.
again.
February 21st from 9 until noon. And again, lots of screenings, lots of free products, and what do you call it, swag, and lots of great smiles with people that want to hear you, understand what's going on for you, and give you solutions that you can stay well in your homes and life.
And that is so important. That day is so important that my husband, and he said, you guys have to be there, because I don't care if you're getting on the plane later on that afternoon at 1 o'clock to go to Washington, D.C. to go do advocacy on that Tuesday before the president gives the address. I want you to be at that. He goes, that is important. That's right in your neck of the woods. You've got to go support your friends, Diane. And I said, well, that's what it's all about. So I am so excited to be there. And I thank you so much for asking me to be a part of it. And I think Jennifer's going to be able to join us, but I do want everyone to mark their calendars for October 31st. What are we all going to be that day? We are all going to be about finding the white flower finally for Alzheimer's. So Jennifer, tell us what that means.
Well, the white flower symbolizes that we have our first survivor of Alzheimer's disease. So this is, Diane is alluding to a portion of our program on Walk Day here in St. Louis, one of the top 10 walks in the nation. It'll be held at Chesterfield Amphitheater, and the event is free. It's a family event, and it's the one day when you're in this journey that you're not alone. You can look across thousands of individuals and just lock eyes and know that that person understands what you're going through or what you've been through. So come join us. We would love to have you.
And if you're thinking, I don't know if I can walk, I don't know if that's really for me, you need to go see Denise and get that balance test.
There you go.
So you can be confident in your walking. So by October 31st, you are ready to go.
Thanks,
and you will see Courtney and I there.
Very
just
good.
cheering you on. So Courtney, I want to just give you a moment to say why you thought this was so important to bring this Tune In Tuesdays to everyone and make this available.
So I guess really, especially women's health, I feel like I just lost my mom in April of last year. It was really, thank you. It was the biggest loss I've ever experienced in my life. But I realized, after you lose somebody, you kind of start putting pieces together, realizing, that they were a lot sicker maybe than they had let on. But you just didn't realize it in time. To make a difference, I guess. So I want to be able to make a difference in others' lives that I couldn't make for my mom, that I couldn't get her to become aware because I wasn't aware. And I think that's what we all need to do is be more aware of ourselves. And that's where we're failing as a society right now is we're so worried about everybody else and everything else because the world is a mess, but it's not going to be put back together in one day. And we can't put it back together if we're not put together ourselves. And also, Diane, I just realized I didn't really touch on this in the presentation part. And I think having a community is such a powerful tool as a woman as well. Having the friends around you and having like things like the Walk to End Alzheimer's or events like Denise is hosting, that really gives us a chance to come together and face these problems together. So.
Yes, it is so important to have community. And I will say that I know, Joyce, you have a wonderful, wonderful group of friends.
Yes,
and
I'm blessed.
You have beautiful friends. I love them so much.
Yes,
And
thank you.
it's just this conglomerate of wonderful people that I love seeing every year. I know I'm going to see all of them, when it comes to like time to get new policies or to just review every year during the annual enrollment period. And it's not enough time because you can feel the love in the room and it's real. They love each other and they've loved each other for a really, really long time. And to have that is so important because when you are faced with something that it could be just devastating for you to get a diagnosis, that you're not alone, you're not embarrassed, and you can reach out, and you know that there are resources, there are people that love you and that care for you, there are organizations that love you and care for you. And I will say that having an accountability partner for my own self and my own health journey, and being open and honest and saying, I know that I'm recovering perfectionist, and so I don't like to admit faults. And then I look up to my creator and I say, okay, humble me, like Denise said, and let me realize that I am not perfect, and that there's things that can happen in my own body. And by admitting those things, I can seek out solutions. And so don't try and do this in a vacuum, folks. Make sure that you have that support. And my accountability partner has been there for me. Of course, my husband has been there for me in my health journey, but it's a journey. It's not a sprint. It's not a marathon. It is a lifelong journey to just get better and better and better at each day. And Denise, you were going to add something.
I want to add how beautiful it is that you mentioned that, as a learner and as a human, we're given a body, and God said, go do everything you can do with this body. And then sometimes when you get sick or you're feeling symptoms, that's the way God's nudging you to say, okay, humble yourself, lean in and look. And that is exactly where you come in when you're able to help people see the vision of what insurance could do for them and how you can carve out wellness for yourselves with programs and policies that you employ. I am just overwhelmed with your gratitude for life and how it shines forth to other people.
No. You're gonna make me cry. Because I will say that I'm so lucky to have clients that get it, that know about community, know about listening to themselves, know about cheering themselves on, as well as others. I'm thrilled that I have friends like you, Denise, and you, Jennifer, and Courtney, in my life, that I can say, look at these beautiful women, look at their beautiful hearts, and know that it doesn't just exist on this Zoom. There are more women out there that want to help and want to help you. And that is our goal in our life, because giving is the best. Receiving is not. So I will say that. But when you receive some news about your health, receive it so that you can give back your best self in return. Right, ladies?
Yes. Yes.
Amen.
Okay. Anybody have any aha moments before we wrap this up?
Good question.
No?
We'll say one thing that, if our well goes dry, nobody else is going to replenish it. And we need to take care of ourselves first so we can always dig a little deeper and get to take care of more people. But we have to really learn to take care of ourselves first so we can take care of others.
Yes.
Amen.
So be assertive in your talk. Don't end anything in a question with the tails up, everything in a tails down. So in that style, I will say, you are all marvelous. In my book, you are fantastic. There is no question to it whatsoever. And I appreciate all of you. Thank you for being here today. I love you.
We appreciate you, Diane. Thank you.
We love you, Diane. Thank you
so much.
Bye, guys.
Bye.
Thanks for tuning in.
Bye.
The next one to tune into is March 10th. And that one is going to be at 10 o'clock, March 10th. And the Zoom link will be available through Courtney, or you can go to my website, www.dianeinsuranceSTL. And March 10th, it's heart health. Here's a little bit to know. 1 in 5 people's deaths are attributed to cardiovascular diseases. We will talk about keeping the heart healthy. So lead from your heart, and happy Valentine's Day.
Happy Valentine's Day. Bye-bye.
Bye.
Bye, guys.
Talk to you soon.
Love you guys. Mwah.